We are hearing loud and clear a call for coordination across philanthropy, nonprofits, government, business, and beyond. Today, more and more Americans from Washington State to Washington, D.C. are grappling with issues that have long been at the core of philanthropy's work. How do we resolve economic and racial disparities in healthcare, housing, education, and elsewhere? True, these questions have always demanded our intellect and creativity, our time and our treasure. But this moment feels much more urgent and fundamental, and the consequences of our actions or inactions may truly mean the difference between life or death for many, especially among our most vulnerable populations. We have to ask ourselves, what sort of California do we want to see emerge in the wake of this pandemic? And what will we each have done to make sure our future is going to be healthier, safer, and more equitable? These questions have fueled Philanthropy California and our entire statewide community to mobilize so quickly in the past few weeks. We know philanthropy must respond effectively, rapidly, and equitably to the economic and public health crisis that has overtaken us. That is why we went ahead with today's summit. I want to acknowledge that our summit would not have been possible without our staff, boards, sponsors, and funders. A special thanks goes to our summit presenting sponsor, Bank of America, our summit's gold sponsor, James Irvine Foundation, silver sponsors, First 5 LA, California Endowment, our bronze sponsors, Archstone Foundation, Bank of the West, California Healthcare Foundation, California Wellness Foundation, City Community Development, Conrad and Hilton Foundation, Gonring Lynn Spahn, Mickelson Found Animals Foundation, and Weingart Foundation. Our donors are Catch a Fire and Stupski Foundation. Thanks again to our sponsors, and we thank all of you who are tuning in today for your willingness to confront these difficulties and do this work today and every day. Even when our own lives feel uncertain and hard, we can show up and be ready to listen intently to the proven wisdom of community and civic leaders. Voices that demonstrate the power of social movements and the advocacy needed to put us on a better path. I'm so glad we can be here to walk that path together, despite our physical distance. Now more than ever, in the days ahead, we are going to need a strong, well-informed, and deeply networked philanthropy community. It's now my honor to welcome the next speaker, Kathleen Kelly-Janis, Senior Advisor on Social Innovation to Governor Gavin Newsom. I'm proud to say Philanthropy California successfully advocated for this critical position, and we are seeing the fruits of our labor this past year in big ways, especially during this challenging time. Kathleen has become a thoughtful and passionate partner to our work, and I'm so glad she is able to join us today. Kathleen, I leave the stage to you. Thank you.
Thank you so much, Chris. I am not Kathleen Kelly-Janis. We're working to get Kathleen on currently. But while we work to get Kathleen on, my name is Daeron Fu. I'm the Vice President of Public Policy and Government Relations for Southern California Grant Makers and Philanthropy California. While we work to bring Kathleen Kelly-Janis on, we do have Dr. Sandra Hernández and Dr. Mark Ghaly with us today. And so what I'll do is I'll introduce Dr. Hernández and Dr. Ghaly and pose some questions while we work to get Kathleen on. So Dr. Sandra Hernández is the president and CEO of the California Healthcare Foundation. Prior to joining the foundation, Dr. Hernández was the CEO of the San Francisco Foundation, which she led for 16 years. She previously served as the Director of Public Health for the City and County of San Francisco. And she's also co-chaired San Francisco's Universal Healthcare Council, which designed Healthy San Francisco, a landmark healthcare initiative. It was the first time a local government in the US attempted to provide healthcare for all of its constituents. We also have Dr. Mark Ghaly, Secretary of the California Health and Human Services. Dr. Ghaly was appointed by Governor Gavin Newsom in 2019. Dr. Ghaly oversees California's largest agency, which includes many key departments and are integral to supporting the implementation of the governor's vision to expand health coverage across access to all Californians. Dr. Ghaly has spent his career in public service, and in 2011, he was the Deputy Director of Community Health and Integrated Programs for Los Angeles County Department of Health Services, where he launched and created the Whole Person Pilot Care Program. It's a pleasure to have both of you, Dr. Ghaly, Secretary Ghaly, Dr. Hernández. Thank you for joining us today.
Thank you, Sarah. Good morning, Mark.
Good morning. Thank you. And apologies for being a few minutes late, but excited to get into this. Thank you for having me.
So we're going to launch straight into this. And I would love to ask, what is the current state of affairs from the state's perspective, Secretary Ghaly?
Well, let me begin by just thanking everybody on the meeting for all of the tremendous support and really rolling up the sleeves in this critical moment for the state. You know, we are at this moment, as you've heard in the governor's press conferences, I would say cautious in our optimism and very aware of where we need to continue to focus our investments and our efforts. So I will say that as we learn more and more about what we call here in the State Operations Center, the impact of non-pharmaceutical interventions. So, you know, as it sounds, those things that we can do by our own personal actions and by setting up the structure of our communities and societies to change the transmission of COVID-19, they've been very effective. We even see differences across the state wherein if a county or an area implemented such efforts a day or two before, that it has had a significant response in terms of transmission, morbidity, mortality, and the feel of how things are in each community. So I will say that we are pleased with the decisions that our county leaders made across public health and our electeds, as well as, of course, what the governor led with on starting in early March and culminating with the statewide stay-at-home order on March 19th. And we've seen the fruits of that effort, 40 million Californians strong, to really what they say flatten the curve. And I will say one thing that has impressed me, and I'm not sure what Dr. Hernández thinks, is how responsive or sensitive this virus and the transmission has been to these non-pharmaceutical efforts across the state. So I share that point because as we continue to look where we are still vulnerable, and I think there are many areas where California remains vulnerable, and I know we're talking a little bit about that today, but many of our historically underserved, overlooked populations are still shouldering an undue burden of COVID-19, not just from infection standpoint, but mainly and primarily from the fact that it impacts younger brown, Black individuals across the state in a way that is not surprising, but I think unexpected from what we understand based on the transmission. And that tells us that many of the areas of addressing health disparities of the last many years, it still sort of unmasks the fact that we have a long way to go. Similarly, many of the essential workforce is still going into their jobs without the kind of protection that we would optimally give them, meaning the ability to have the personal protective equipment, access to testing so that we can slow down transmission where we may or may not know that it's happening. And this idea that that workforce continues to go into the fire without the sort of care and attention that we ideally would provide them is something that we have to continue to work on. And so it leads to the last point that I'll make as really where we see this vulnerability play out the most is in some of our congregate care settings. So places like, I know the skilled nursing facilities or nursing homes is an area of focus, but even more so on the disparity spectrum, the residential care facilities for the elderly, those are the small 6 to 10 bed facilities that often don't have the same licensing requirements, but take care of some of our lowest income, most vulnerable residents of California, that those become equally vulnerable to spread of COVID because many times the workforce who needs to keep coming to work to feed their families and have the resources they need don't have the protections that are required. And then that extends to areas like our jails and prisons, our homeless shelters and encampments, many of the different settings that take care of our foster youth, and the list can go on. But essentially, any congregate care facility, I would say, what keeps me up at night is our ability to support those facilities with not just staffing and testing, but broad scale communication on how we impact the transmission of COVID-19. So all in all, I am grateful and count the blessings that some of the decisions in California have led to, but I am cautious and vigilant that we need to continue to abide by our current stay-at-home efforts and orders, and to ensure that we put every ounce of energy we have in protecting these vulnerable populations and the facilities that can really tip over into significant challenges for the state pretty quickly.
Thank you, Secretary Ghaly. And I think you've touched on something that Dr. Hernández, from your perspective with regard to Dr. Ghaly's comments about vulnerable communities, what's the current state of affairs from your foundation's perspective, and how is the foundation prioritizing communities that historically have not been prioritized?
Yeah, well, thank you. Good morning. Good morning, Secretary. Let me just start with just acknowledging your leadership, your service, the amazing team you've brought to this. And just to your point about Californians largely abiding by the stay-at-home order that the governor put out, I would just say it's extraordinary that 85% of the population in California is supportive and participating in that order. To your point, it gives you the opportunity to really focus on these areas that you described as being hotspots and/or for populations that we know are always vulnerable and once again are vulnerable. I would say California Healthcare Foundation been doing two things, and I'd be interested in the Secretary's thoughts about ways we can further reach, for example, into some of our ethnic communities and our minority communities and our non-English speaking communities. One of the things I think the governor has done an amazing job at is really communicating in a clear and transparent way. But it's also important to have that feedback loop and to know who's hearing it and who isn't and how do you reach it. So one of the things the team did at CHCF was to do this tracking poll very early on to understand a few things. One was, what was the sentiment about testing? Because Secretary, I think, recognizes how important that is as a public health tool. And really just to understand where we were at a baseline and to be able to track that over the short term and long term as testing hopefully soon becomes mainstream. And that's been very helpful just to get a read and a pulse and a feedback loop, hopefully, to the governor and his communication team so that you know where messages need to reach and the like. The philanthropic sector is looking at how to support ethnic media and community media to make sure that they stay viable during this period of time because they reach such important audiences. And as I think we move further out from stay-at-home orders and begin to think about really how we target contact tracing and isolation and targeted quarantine, it is going to be so important to continue to maintain the trust in these really diverse communities. So keeping community media together, a number of foundations are working to support that effort. And then, healthcare is just going to be transformed in very dramatic ways and has been already. And one area, of course, that we think is incredibly important to respond to the demand has been this opportunity to do telehealth and telemedicine. And our safety net clinics and our safety net hospitals, with the support of all the payment that has come along with that and releasing of some of these obstacles on a regulatory basis, it is really an important means by which low-income folks who don't historically have good access, either because of limited workforce or because of geography or the like, it is such an important tool. And we think it's really important to be able to feed that capacity and technical assistance, which is enormous. And I think that's something we're going to see in a lasting way. We should learn what works. We should scale it. It is a useful tool, both in terms of limiting transmission, but also really important to be able to reach people with basic primary care needs. So those are two areas. We also really want to support the work that the governor has been doing on universal coverage. If you look at other countries and you look what's been done there, the places that have been most successful have a universal healthcare system, and California is well on its way there. Big challenges, I'm sure, ahead. Secretary, I'm sure will want to comment on these, but even as we move into a recession, it is so important that we continue the effort to get everybody covered and in the system, something CHCF has been working on for some time in support of the state, and we continue to think that's a really important body of work.
Thank you, Dr. Hernandez. And Secretary Ghaly, to Dr. Hernandez's point, I know philanthropy has the ability to, in this moment in time, to think long-term and to hold the simultaneous immediate response and that long-term vision thinking. From where you sit with regard to Dr. Hernandez's comments, where do you see philanthropy in terms of the response, not only now, but in that long-term thinking? And how can we be supportive and create that space to support you and the governor's work in thinking of that transformative change that's required as a result of this crisis?
So, yeah, thank you. And Dr. Hernandez, thank you for those comments. I think they're spot on. And I'll tell you, last week, having spent the last nearly 2 months just focused on our response, last week was one of the first glimmers of opportunity to start thinking about not just the immediate what's happening today and in the next week, but longer term, because those are going to be both the challenges but opportunities to come through, and really having benefited from this period in history to transform what we're able to do for all Californians, but particularly those who are dependent on our safety net services. So I'll come back to that in a moment. But the first thing I will say is, in the immediate short run, as we think about moving into what we commonly say is suppression phase of this pandemic, right? So we're moving out of sort of the mitigation containment conversation and now into suppression, understanding that we want many Californians to return to the ability to earn a salary, put food on the table, move around in a way that the stay-at-home orders don't allow, and being able to make sure that we use our California resources to quickly and immediately identify where there might be hotspots of transmission. And what Dr. Hernandez and I have already spoken about, but I know is a very important issue statewide, is how do we make sure this idea of testing, tracking, tracing, isolating, quarantine, and I add supporting, can be done in a way that recognizes that certain communities will do this with ease and without much disruption, and others are going to really be challenged to do it safely, responsibly. I look at our philanthropic partners, not just because of your resources in terms of dollars and programs, but really because many of you have real boots on the ground relationships that will make this whole concept that, frankly, 3 months ago, when I look back to wondering would Californians or Americans be open to this idea at scale, it was hard to imagine. But I think today, given the alternatives, I think everyone wants to protect their families. Everybody wants to protect their communities. So being able to find the ability to do not just the contact tracing after testing and exposure, exposures are being worked on, but that ability to isolate or quarantine as necessary in a supported, responsible way, I think is something that is going to have many different flavors across the state. And we're going to need our philanthropic partners to help us not just think about how to do it, but actually doing it, right? The governor later this week will announce an effort to bring thousands of new contact tracing staff to our local health departments to help with this, because they have the expertise in a limited way, but they can't do it. Dr. Hernandez, who ran a public health department, knows that there are some people who can do this in each public health department, but not nearly enough to do it for COVID-19, especially as we begin to move around and we expect transmission to go up from where it is today. So that is, to me, a very critical place where our philanthropic partners will need to be sort of hand in glove with us as we think about it, both at the local and state level, because it's not just an opportunity to really contain or suppress the disease, it also creates a new opportunity, and not so short term. I think we're going to be doing this for 18, 24, maybe even longer in terms of months. That it creates a job opportunity for some people who know their communities, care deeply about this work, and could contribute when maybe they've just lost employment or are underemployed at the moment. So I think it becomes this tremendous stimulus and public health opportunity for California, and we need your help with that. In terms of,
Secretary,
yeah, please go ahead.
go ahead. No, I was just going to say, for the philanthropic sector, I think that also means that not only do our health foundations need to be supportive of this, but we have foundations that have been working on economic development and workforce development. And so I think for the sector itself, it's important for us to be able to synchronize the opportunity to make sure that jobs get developed in places where they're most badly needed, and at the same time that we're building on this infrastructure of public health that has been divested in over the last 30 years. So I think it's a call to action for philanthropy as well, for us to come together and figure out how we work conjointly with the Secretary and with the Labor Agency, as well as California Department of Public Health on these issues. I wonder, Secretary, if you would comment. You've been housing a lot of people who are unsheltered and who have been homeless, and you're putting them in hotels. And I wonder if you just comment how you think that is going, what you're learning. Is there anything that you're moving through that effort?
So Project Room Key is one of, I think, sorry, heard an echo. Can you hear me okay? Yes, okay. So Project Room Key is an effort that really a group of us thought up at the very beginning of our response, knowing that individuals who are facing homelessness often also are burdened by significant chronic illness and are high risk to mortality from COVID-19. So a very deliberate effort working with our social services department here at the state, our business and community development colleagues, and a number of others, including the governor himself, who, of course, had been waging a response against and to end homelessness in California, as testimony by his focus in his State of the State address. This became an opportunity to, in a critical moment, move thousands of very vulnerable individuals facing homelessness into hotels. I think the response has been tremendous in most of the state. I think many counties, some early adopters, those you would expect, and many others are now coming to the table, having found hotels that frankly are suffering themselves with a drop in the number of people traveling and moving around California, that this became both an opportunity for them to have a steady source of business, but also became a place where we can put those unsheltered who are vulnerable indoors with the services that they need in this period of time. I think one of the opportunities, of course, is that some of those facilities, those hotels that we've been able to identify and enter into lease agreements for may actually become sites for permanent supportive housing down the road.
Right.
That is definitely part of our interest and strategy. We know it works in some sites better than others, in some communities better than others, but we are interested in that initial investment around COVID-19 housing to turn into long-term permanent housing for important segment of our population facing homelessness. That said, I just want to also be very candid that there are parts of California that continue to be against this idea. I think because of the overall increased stress on all of us in this COVID-19 period, we see some cities and some communities coming out even stronger than before against Project Roomkey. And as you are all supporters and wonderful on-the-ground messengers, I think it's important to understand NIMBYism is real and stronger than ever. Right. And we need to continue to look at solutions to provide information about what we're trying to do, why it's important, not just around the individual, but also this is a key strategy to make sure that the health system is protected and not overwhelmed by individuals who we can avoid having infections altogether. So I think it is one of the shining stars in the response. I think it has, can and likely will have a lasting impact, but it's something where we need to continue to keep sort of our foot on the gas in terms of creating these opportunities and building them across the state.
Secretary, if I could, I just wanted to raise one other issue with you where I think the state and the governor's leadership has just been extraordinary. And it also falls into this issue around public charge and the federal response and the fact that none of the federal relief that's coming to communities and individuals are ones that will reach our population that aren't documented. And I just wanted to compliment the governor and the leadership that's been shown there with philanthropy working in conjunction with the governor to make sure that this part of our working population in our communities is not left out in the cold at this point in time. And so I know that there's a tremendous need there in these communities around access to care, around resources. These are people that are our food workers, they're our grocery workers, they're working in the farms that are feeding us. And so I thought it was just an incredibly bold and important action that the governor took in regard to that. And I wonder if you have thoughts about what might be next there.
Sure, and we are proud to work for this governor for exactly the reasons you mentioned, right? There is this bold decisiveness to do what he believes, not just in his mind, but in his heart, to be the right thing for all Californians. And this concept of California for all is more meaningful now than ever before. And I've been humbled and privileged to be part of a lot of these efforts and conversations. And it is laser focused. It is talking about how in the Salinas Valley, just last week, 50 to 75,000 migrant farm workers come into the community, and how do you support them, their employers, and the health system around to make sure that if anyone does become ill from COVID-19, we can support those systems to serve them well. So it goes beyond just the large announcements with infusions of funding. It is really focused on how we find those areas of opportunity to focus our discrete efforts. Another place is San Diego, where we know every single day hundreds of essential workers cross the border to come into San Diego to do work that we depend on, and many individuals crossing the border to seek care. How do we continue to work with that county and our Border Patrol partners to figure out how we support individuals that are looking to California, not just as the place that is leading, but as a potential site to receive the kind of care and service that people yearn. So we are focused not just on the big announcement, which we're all proud to make, but very discrete actions on ensuring that, for example, testing is accessible to all populations. We have had been a real challenge, and I think people should know that when the federal government began to control who gets the testing supplies, California, because of our low level of positive tests and the fact that we weren't overwhelmed, we didn't get the kind of supplies that some other states received. And so we've had to make do with a lot of limitations. I don't know, Dr. Hernandez, how you feel, but I never thought I'd see in my career the fact that a simple swab that I used to take for granted was going to be the lifeline to figuring out how we get people diagnosed with COVID-19. I mean, it's just shocking. So California has stepped up very recently, and our efforts continue to accelerate to bring testing to all communities. But this week in particular, we'll be hopefully announcing a partnership to bring nearly 100 sites for testing across the state, focused on communities that we identify as testing deserts. And I think our lower income, diverse communities, those where many of our immigrants call home, are going to be targeted and focused on as primary sites. So I think there's a number of things coming up that supplement the big announcement that was made last week.
Secretary Ghaly and Dr. Hernandez, when folks are listening to this, they're hearing, okay, swabs, they're hearing testing, they're hearing a lot of different things. And from your perspective, if you're a regional funder or a local funder, your next question is like, well, what can I do? How do I get the resources you need? And Dr. Hernandez, you touched a little bit about this as well in terms of in your call to action. From your perspectives, where do you see, just given the diverse nature of philanthropy and the different locations we are, and making sure resources get to the right places, how do you advise philanthropy as a sector and funders locally and nationally address this issue?
Well, I think I would say that, first of all, a lot of what the state is trying to do, you have to do in localities and local jurisdictions. And there are some very good examples, for example, in homelessness in Santa Clara Valley, which had a very big hotspot to begin with, had a large unsheltered homeless population. And there you see coordination with the county, with the city of San Jose, with the philanthropic sector, with the business community, and with local not-for-profits that have done an exceptional job of getting anybody who is homeless and COVID positive cared for and in isolation and taken care of. And I think looking for those opportunities where you can connect locally to synchronize and to do it in conjunction with the state, but also to recognize that a lot of these communities that the secretaries is talking about have community foundations. They have organizations where they can reach deeply into the community, and that's the kind of solution you need to be able to do. So there's great leadership and vision, and the focus of the administration on populations that have historically been underserved and have great health disparities to begin with is where philanthropic institutions, working with the business community, working with local health departments, working with our local universities and academic health centers, I think there's a lot of places where you can make those kinds of impacts.
I'll just add to that. I think, again, the credible messenger concept, especially for the community foundations, is key. The understanding we have been doing a lot, but no, we can't do nearly enough to communicate with the number of various communities across California. And especially as we enter into this, it's one thing to communicate about stay at home and that concept, but when you move into this concept of tracing contacts, isolating and quarantining, which I do see as an important part of our response, as does Dr. Hernandez, I think the ability to, in a very effective way, communicate that to communities is going to be essential. And so whether it's done by the staff and people at the community foundations, or whether it's done through funding our local partners with the boots on the ground, I think that's going to be very critical. And it's going to be tough, especially for those who are asked to quarantine when they don't feel sick or ill at all, when we're asking them to potentially miss work or miss an interaction with a loved one that is critical. I think we have to find a way to support people through that. And it's a big, bold idea to think about wage replacement and making sure people can continue to pay the rent. But I do believe that's where we are at the moment. We have to think thoughtfully about how we allow Californians to do the right thing while not losing out on things that are important for their health and their family's health.
Thank you, both of you, for staying on. I know, Dr. Ghaly, you have your noon press conference that we have now accustomed to seeing you. You are a staple here in my home, here in Long Beach. And so my last final question to you is, what is your message to those listening in from our field, and your closing thoughts as we embark, as you just said, Secretary Ghaly, for the next, not just next month, but 18, maybe even 24 months? And Dr. Hernandez, from your perspective with being a statewide funder and being a public health official yourself.
Dr. Hernandez, please go.
Well, I would just say, first, to put a very fine point on something the Secretary said, as we get into more community focused contact tracing, you really do have to have trusted people who are doing that work. And that means culturally appropriate, means language appropriate, it means to be known in the community. And so that opportunity for trusted leadership and for people to use that platform of trust to be able to do the things we're going to need to be able to do. There will be many people who will be tested positive who should go into isolation. And that will mean if they can isolate at home, and many will not be able to, they have to trust that where they are going to go, they will be fed and cared for, and whatever social needs they have will be met. And that is just very local, hard work to do, and so important if we're going to get it right. So I would say that. And lastly, I would just say for the philanthropic sector, even while the Secretary and his team and the governor's office and all these agencies are doing all this amazing work, I think it is important for philanthropy to look a little beyond the 2 years and the 3 years and say, what have we learned from this? What does it mean? What does it mean for our funding? What does it mean for our priorities? Because extracting those learnings will be so important from a policy point of view. What will our delivery system look like in the future? We have that luxury. We should take advantage of it, even while we're partnering very closely and networking very closely and coordinating with these efforts from the governor's office. So again, I want to thank the Secretary, his team, his service. And, California is quite unique in having this very vigorous philanthropic sector. There's opportunity to look at how we're doing criminal justice differently as we're releasing people that don't need to be held in detention centers and the like. And so I think there's just a lot of learning that we should be calling even while we're responding very actively. So thank you, Secretary, for your time and for your leadership.
Thank you, Dr. Hernandez. Always a pleasure to be usually in the same room, but I'll take the same Zoom with you, and always humbled by your thoughtfulness and your compassion in every moment, but this one in particular. I would just say, it's a real privilege to be in the role that I'm in at the moment. And although it's clear no one ever anticipated this when you take a role like this, but I feel very humbled and privileged to be here to work with a governor and work with a team at the state. But just to pick up what Dr. Hernandez said is, this is going to be about our local response, right? And the state is going to give important guidance, resources, set some guardrails, really move some important things. But I'm always impressed, having spent most of my career in counties, that it's really going to require us to figure out what our regional opportunities and challenges are, and have all of you work closely with your local governments to figure out how you support whether it's plugging a hole or accelerating some sort of change that we need to see so that those traditionally overlooked don't suffer the same almost predictable outcome that they might if we don't act and act immediately with compassion and clear decision. I know that many of us, many of you are making those sorts of contributions. I applaud you and I'm grateful that you are. I would say that it is important that as we balance the sort of morbidity and mortality consequences of COVID-19 and the physical health issues, that there are these large economic and public health challenges that if we don't think about 12 months, 24, 36 months from now, immediately, we're going to miss this opportunity to rewrite history for decades to come. And we are already beginning to look at what does the delivery system look like at the end of this? How are we using telehealth differently? What do FQHC clinics and hospital-based clinics, what do they look like? What does it look like to be in a group visit for diabetes? What does it look like to be in a walking group? All of these things that are essential parts of keeping people healthy need to be reconsidered. But it goes way beyond health. It's about schools, it's about businesses, it's about how we get to and from work. So your involvement in those conversations now at the local and state level is very important. I think a number of you are on the governor's economic recovery task force. We are grateful for your service and your influence on that. But there'll be many, many other opportunities. A number of you are already funding our academic partners to look for not just treatment and other therapeutic, but to understand some of these industrial changes that are going to be required for us to not continue to be vulnerable to things, COVID-19 and things like it that might emerge in the future. So despite the great sadness I have from any loss of life in California, I'm encouraged by the California spirit to innovate and not get beat down, but to get up and keep moving. And I'm seeing that every single day, and I appreciate each of you for your contribution in that way.
Secretary Ghaly, Dr. Hernandez, thank you so much for your time today, for your leadership in this field and in this work here. I know as a Californian speaking as a resident here that I'm grateful for both of you and for making this truly a golden state in this incredibly difficult time. So thank you both for your leadership. Thank you to all the amazing frontline responders and healthcare folks out there and essential workers. So thank you both.